everybody, so I decided to do this as a video because there's just no way I have the patience to put this down as a, 600 page freaking Facebook post. A lot has been made of social distancing, and it is really, really important. But I think people have been conveying the message poorly. So right now what you're hearing is, hey, social distance to protect the vulnerable people. And that's good. That, do that. That's important. Vulnerable people matter. And I didn't really think that was something I would need to say, but apparently it's a thing. So don't murder people by going out is a good thing, but I think it's hard for people to conceptualize what that means, how their interactions have an effect 3-4 people out. Somebody 6 degrees of coronavirus, instead of like Kevin Bacon. I like Kevin Bacon better than coronavirus. It's just the thing. So instead, I'm going to make the case here for the selfish reasons for social distancing, the selfish reason you should be doing this, because if you don't care about anybody but yourself, you should still be social distancing. I don't care if the reason you social distance is because you care about my friend that has very, scary multiple myeloma cancer and is immunocompromised in every way at this point. Or if you care about, my mom who's, in her 60s and, has failing health, getting older. I don't care. If you don't give a fuck about those people, fine, whatever. Here's the thing. We are facing a healthcare collapse, and that message is starting to get out, but it's not getting out as well as it should. What it means if there is a healthcare collapse isn't just that, old ladies and sick people die. That's an other thing. That's not yourself. It will happen. Don't get me wrong. They will die. And that is objectively horrible. But I want you to think about the fact that here in the United States, we have had massive consolidations in hospital and medical care. We've had massive, closings of rural hospitals. Everything has been put to how much we can stretch one building to serve the most number of people with the least amount of quote unquote waste. So that means there's not a lot of spare beds, and rural hospitals in particular face, almost full capacity all the time for things like heart attacks and, illnesses and car accidents and everything like that. So let's break down what can happen. So, but just real quick, because I realize I'm sending this out and some of you may not know me. I was pre-medical, which is just a fancy way for saying I really wanted to be a doctor. It was going to be fun and great, and didn't get there. Not because I didn't get the grades, I did, but because I became disabled. But while I was on my pre-medical path, two things that I participated in that I had a deep interest in were emergency medicine and disaster preparedness, and volunteering with the over at Oregon Health and Science University with families in the trauma and neuro ICU waiting room and with the palliative care unit. So I got to kind of know the ebb and flow around, and also my own personal experience. I had babies who were in the neonatal intensive care unit. So I kind of have a pretty close layperson look at these systems. Oh my gosh. Didn't realize systems was going to be the hard word of the day, but there you go. Not coronavirus, symptoms. Systems, bucket. Words, right? And so what I saw a lot of these times is how important these places are. I watched patients, this young woman who had stomach cancer, and she didn't get it checked out, didn't go in, put it off, put it off, put it off. By the time she went in, she was, it had metastasized, and I will never, ever, ever forget this young 20-something. This young 20-something girl with their family around them as they died, because it had gone too long and there was no way to treat it anymore. It's just devastating. I watched a mother grieving in ways that no mother should. So, yeah, when I think about the impact, we keep these hospitals at full capacity, or near full capacity. Some hospitals I've heard operate with a 35% leeway. Okay, that means they've got 35% more like open beds that they can use to fill up. And what we're seeing from doctors, hospitals, medical care facilities right now is that they are taking anybody who is in those systems that they can, for any reason, pull out. They're doing so. Mind you, these are people who are in the hospital for a reason. Like, nobody stays in the hospital because the food is great. I mean, OHSU's got some amazing food, but it is not that good. I'm sorry, you guys, still love you, but no. And these people some of them are having to miss procedures, so they're not going to be in there getting the procedures they need. And they're clearing out the space. So once that space fills up, so if we end up having, which we are so likely to at this point, a healthcare collapse, people are going to be inundated coming in with this interstitial pneumonia. There's another word in there. I'm not a medical professional. I'm just a med geek, so I'm going to get away with not getting it right. Pneumonia. So they're going to have that. So that means that people who have a heart attack, so, you don't have a diagnosed heart condition, you're in your 20s. And this can happen, you have a heart attack. Now, either they have to choose your life or somebody else's. And that's if they can see you in time at all. When there are people, you've seen wait times in emergency rooms, when there are people lined up in the hallways, lined up outside, in tents. Those wait times they're going to be, it's so long. I don't want to try and think about the actual numbers, because if I do, one, I'm going to get them wrong. We are not prepared for this. We do not have a way to predict this. Because we haven't had enough testing, because we are just not prepared. We are not prepared. And that means that if you are young and you break your leg, you are going to have, assuming you can get in, assuming you can get treatment, after hours and hours and hours and hours of waiting, you can get somebody. That is going to be a doctor that has been working for hours and multiple shifts. And these are doctors that are already overworked. Just look up overworking doctors. Go to kevinmd.com. That's an amazing site for medical professionals and the lay public alike. And you will see time and time and time again, in normal mode, doctors are overworked. Facilities are filled in normal time. So facilities are filled in normal times, and you break a leg, you fracture your leg, and it's inside, and they need to surgically go in there. If your child does that, who are they going to see? If they get to see anybody, and in many of these cases, they might be able to pull a doctor away. But understand that is not going to be a doctor at their best. That is going to be a doctor who's overworked and doing everything for so many people, who is so emotionally devastated because the choices and things that they have to do, because we don't have enough supplies. We don't. We know that. We know that. So you go in there, you got a skateboard injury. You were going out with, what's her name from spring break, and you've got a flare up of something, and it's going from bad to worse, and you are in pain. Too fucking bad. Too bad for you. You are not a priority at that point. And there will still be primary cares, but this is going to be hard. People will die, and I am not talking just about the vulnerable. I am talking about 20-somethings that have a stomach pain that they ignore because nobody can go to the hospital for secondary things. I am talking about children who get injured, who wait too long because parents don't want to take them out. I am talking about that time that somebody got into a car accident, because now, depending on your condition, a condition that maybe they could have saved you for before, but it's so bad right now that they're like, I'm sorry, we cannot use a ventilator on this person. Their condition is so bad that, yes, if we had all the resources available that we usually have, we would make a go to save your life after a tragic accident. We would go for it, and maybe you would live. When that maybe is in there, and they have a whole waiting room of people that have a higher percentage of likelihood that they will survive if they give that ventilator to them instead of to your dumbass that decided to go out, decided that social distancing wasn't cool enough for you, decided that vulnerable people did not include you. I guess you won't care then either. You'll be dead. But I'll still care. Whether you were out there on the beach, I'm never going to be happy for those that died. I'm not going to be happy to see the stories of your parents, your friends, your family, when the shock hits them, that because you were hurt too badly, that calculus didn't go in your favor. I don't want you to die. So if you need a selfish reason, shit happens. And when the entire healthcare system is facing a collapse because we have so many more sick people than we know, because we don't have enough testing kits, understand that for you, that means you could end up dead. You could eat something bad. That bad fish, that bad drink, that overdose. These things, sometimes people will make it. Sometimes they'll get saved, but some of you won't in that healthcare collapse. And I hope, and I pray, for what it's worth, that you'll listen, stay home, stay safe, stay well, stay home.